Hi, welcome to our next episode of Here Today. I'm Dr. Joanie Davis, audiologist and owner of Davis Family Hearing. We have 5 locations in West Central Florida, and I started doing this YouTube channel because I want to spread a message of hope, and I want to educate the general public on all of the hearing loss treatment options we have, all of the balance treatment options we have, and today all of the tinnitus or tinnitus treatment options we have. But before we go further, I'd like to invite everyone to hit the subscribe button below this video so you can see the next video that we post next week to spread our message of hope. The number one complaint I get from my patients is that they have ringing in their ears, and it can also be one of the most debilitating symptoms. Imagine if you're not hearing ringing in your ears, what it would be like to hear an annoying sound incessantly, all of the time, that no one around you can hear. It's distracting, it's stressful, it can cause anxiety and depression. I've seen multiple severe cases in my office. But to add on top of that, the majority of healthcare professionals out there aren't educated in tinnitus or tinnitus treatment. I mean, if you go to your primary care doctor, they haven't gone to school for 8 years to learn about how to treat hearing loss and tinnitus, so they don't know that there's a treatment for it. We at Davis Family Hearing see it as our mission to not only educate patients and family members about tinnitus treatment and any treatment options out there, but also to educate other professionals so that you can get where you need to be. There's such a loss of hope when you're struggling because you're hearing sounds in your head and someone looks at you and says, there's no treatment for it. And I often say that's like ripping your heart out, throwing it on the ground, and stomping on it. It's so detrimental to our patients. There are many different causes for tinnitus. And tinnitus doesn't just have to be ringing in your ears. It can be whooshing, chirping, sizzling, a train whistle. There's even something called musical ear. That very commonly people who have severe hearing losses hear music over and over and over again. I even have patients who say that they hear a baseball game from the 1930s that they heard on the radio one time, just over and over and over again. Can really be extremely stressful. But there is hope, and I'm here to tell you about it. When you come into our office, the first thing that we do is a thorough case history, because there are so many causes of tinnitus or tinnitus. The first thing is we look in your ears. Something very simple. Impacted earwax can cause tinnitus. Secondly, we ask you about your allergy symptoms and do a pressure test called tympanometry, where we put a probe in your ear and vary the pressure in your ear canal. Much like when you go up in an airplane, if you have a good bit of negative pressure because your sinuses are inflamed, it's very common to get ringing in your ears. The treatment is to treat your allergy symptoms. And here in Florida, we use a very easy treatment. A lot of times we recommend local raw wildflower or green swamp honey. That's going to be different for different regions in the United States. But what it is it's the wildflowers in our area. That's the number one allergen that irritates sinuses. And when the bees make the honey from the specific pollen that's causing your allergy, it becomes a natural antihistamine. We also recommend saline nasal spray once or twice a day. After we've gone through those 2 questions, the next question is, move your head up and down like this or side to side. Does your tinnitus change in pitch or loudness? If it does change, then it could be that you have a cervical spine problem. If your neck is out of whack, particularly in the cervical spine area, it can put pressure on your hearing nerve. Your 8th cranial nerve, which is your hearing and your balance nerve, innervates or runs through C4 and C5 of your cervical spine. A lot of times the recommendation to get rid of it is either to visit a chiropractor, and we have many trusted chiropractors in the area, or a massage therapist to loosen up the muscles so your spine can shift back into place. If all of those have been explored, as well as a thorough review of your medications, some medications can cause ringing in your ears. Aspirin is the number one, although I don't see it as much because physicians have started to prescribe the 81 milligram dosage instead of the higher 200 milligram daily dosage. But aspirin on a daily basis can cause ringing in your ears as well as other medications. But the number one cause of tinnitus is hearing loss or nerve damage. If you have damage to your hearing nerve itself, it's much like if I were to cut off my hand, I would get a phantom pain. I wouldn't have a hand there, but my brain would know that there used to be a hand there, and it would generate its own painful sensation. If you have damage to your hearing nerve, your brain knows that there's supposed to be stimulation there, but if it's not receiving it, it generates its own stimuli, which can be anything that we talked about, ringing or chirping. The number one treatment for that is to treat your hearing loss. 70% of the time when we turn a hearing aid on, or a cochlear implant on, or a bone conduction device on, anything that is delivering stimulation to your nerve where you need it because of hearing loss, it immediately masks the tinnitus out. It's my favorite thing to do, to turn on hearing aids and watch somebody who's suffering from that ringing just kind of relax and go, it's gone. Such relief. But the other 30% of the time, while we've treated the hearing loss, and this usually happens with people who really don't have a lot of hearing loss, they don't have enough to actually affect their communication ability, but they have damage in the higher pitch region and they don't need the amplification, so they're still hearing the ringing even after we give them that little bit that they need. All of the devices that we fit have tinnitus maskers in them. So we can program in a stimulation or a stimuli right above where your ringing is. And a lot of times it's a really relaxing noise, like a whooshing or much like a fan noise, and it'll just barely mask out your tinnitus. But if you wear it all day, every day, it's like exercise for your brain, and your brain gets used to blocking it out. What we're doing with this tinnitus treatment therapy is activating the efferent system of your brain. So the efferent system of your brain is the part of your brain that blocks out what you don't want to hear. And it has to, if you're tired or stressed out, that efferent system doesn't work as well. So you'll notice if you're exhausted, you have anxiety or stress, that tinnitus or tinnitus sounds louder. If we have a masker in, even when you're tired, it helps block it out. Our brains prioritize stimuli that's coming into us. So that's our afferent system, the part of our brain that receives stimuli and then it goes to our brain to interpret. What we're trying to do is activate that efferent system so we block things out. And that's a secondary priority for our brains. So it's much like exercise. The first time you run a mile, if you haven't run forever, it's pure torture. But if you continue to do that every day, soon you're running 10 miles and it feels like nothing. It's the same thing with tinnitus treatment. We're retraining the brain to not pay attention to an unimportant stimuli. If the regular masker that's in the hearing aid doesn't work, we go a step further and we Bluetooth you into your cell phone, and there are apps out there that you can use even without a hearing aid that I encourage people to experiment with. My favorite app, my particularly favorite app is the Resound Relief. So it's Tinnitus Relief app, and it's, if you search it on either Android or Apple, it'll be Resound Relief. And in that app, you can design your own masker. So you can really play around with just about any stimulation possible and find out exactly what gives you the relief that you need. And you can stream it at any point in time from your phone to give you that relaxation during the day. The best example I have of this is I had a physical therapist, really fit, very self-aware. He came in and he said, I have tinnitus and I have anxiety and I have depression, and this tinnitus is just sending me over the edge. And you could just tell he was very anxious. He had been seeing different professionals for 2 years, getting fit with hearing aids, but never taking that extra step for the tinnitus treatment therapy. He heard crickets all of the time. So we actually programmed him a pair of hearing aids that had no amplification whatsoever, because he also had something called hyperacusis, which is sensitivity to loud sounds. So he didn't enjoy the amplification, had very little hearing loss, but he was able to wear his maskers all the time, and that provided a lot of relief. But sometimes during the day, he'd have an uptick, and he'd need to activate his app that we had Bluetoothed him into his phone. And I thought it was really interesting because different things work for different people, but he heard crickets all of the time, and he made a comment to me that the only thing that ever masked out his tinnitus was crickets. If he went on a walk and he heard crickets or cicadas, he instantly became relaxed because it was an external sound and not an internal sound. So if his stress picked up during the day, he'd turn on his crickets and immediately relax. 1 week later, after I fed him, he came in and he said, "You have completely changed my life. My stress and my anxiety is through the floor. I just got Employee of the Week because everybody's noticing that I'm much more upbeat and relaxed and much more effective at my job." 100% successful in 1 week. A couple of months later, I got a text message from him and he said, "Help, I lost my hearing aids in the ocean." So apparently he was on a boat and a wave came up and he just didn't think about having them on and the water took them away. And so I'm immediately picturing him being really stressed out, and I said, "Don't worry, they have loss and damage insurance." And he goes, "Oh, thank goodness, you just made me feel a whole lot better." So it took about a week or so to get them in, and I thought by the time he comes in, I offered loaners. He said that he didn't need them, and I thought by the time he comes in, he's going to be super stressed out. And he came in and he said, "You know what? It's really working. Even without the maskers, everything was very manageable. I miss them and I want them back, but my brain is doing it on my own." So I thought that was a really good example of what our tinnitus treatment therapy is like. And you can implement these things on your own, even if you don't have any hearing aids or tinnitus maskers. If you have a fan or a soft, gentle white noise that you can listen to when you go to bed at night, that can help mask it out so you get better sleep. If you're overly tired, your tinnitus is going to be louder. Don't sleep with the television on. The blue lights and the varying auditory stimulation doesn't let you get into good, restful REM sleep. And if you're not getting good, restful REM sleep, your tinnitus is going to get louder. Any nature sounds or music, anything that relaxes you, the better sleep you get, the less loud your tinnitus is going to seem to you. It's not actually changing in volume, it's how loud your brain perceives it. And you can also get a Bluetooth speaker and download your Resound Relief app and Bluetooth it that way as well. So it doesn't just have to be hearing aids, it doesn't have to be maskers, but we really spend time digging deep into what works for you. And it turns into a really fun process and you get a lot of relief, but number one, you get a lot of hope. So I hope that everybody realizes tinnitus, that's the number one thing people say, is that there's nothing that can be done about it, and that is simply not true. So please spread the word if you know someone who is suffering. If you'd like to see us at one of our offices, our phone number is 352-666-8910. Visit us online at davisfamilyhearing.com. Visit us on Facebook, Instagram, YouTube. Please, please, please subscribe so we can help spread the word. And we also have Apple Podcasts, so if you'd like to listen to any of our radio shows. Thank you very much for listening, and until next time.